have to walk, in order to afford care. Sometimes they have to take on more work, which then forces them to be away from home longer hours. And so it's this sort of never-ending cycle that is, in my opinion, very violent and very brutal, and we are not having enough honest conversations about it.
Loida Limbal is the director and producer of Through the Night. She's also senior vice president for programs at Firelight Media, a nonprofit supporting documentary filmmakers of color. Ms. Limbal, thank you so much.
Thank you. Such a pleasure to be on your show.
Now, economists call what we just described as, they call it a failed market. Lots of demand for a service or product, but they can't raise prices because, in this case, the parents can't pay more. You can see the film on the subscription PBS documentary channel or rent it one-off from Amazon. And I invite you to join in on our Econ Extra Credit explorations. You can sign up free at marketplace.org/newsletters if you haven't already. I'm David Brancaccio. This is the Marketplace Morning Report. From APM, American Public Media.
Wayne Hogan of the Terrell Hogan Law Firm.
I'm Wayne Hogan. It's the #1 killer of teens. One text or call can wreck it all. Let's put an end to distracted driving.
Learn more at waynehogan.law.
Baptist Health is a proud sponsor of First Coast Connect with Melissa Ross. Tune in to WJCT News 89.9 Monday through Friday at 9 a.m. and 8 p.m.
North Florida TPO, proud sponsor of WJCT's First Coast Connect, bringing to the community innovation in transportation planning, commuter services, clean fuels, and intelligent transportation systems. More at northfloridatpo.com.
This is WJCT News 89.9 Jacksonville. Ahead in the next 5 minutes, live local news for the First Coast from the WJCT News team.
Contact tracing, or the lack of it, in Florida. I'm Melissa Ross, and just ahead this hour on First Coast Connect, how does contact tracing work for students in Florida schools and in the community to try to get our hands around the spread of the COVID pandemic? A closer look at what is and isn't being done. Then later,
because of the unpredictability of long-term effects of COVID infection, it could very well leave an individual disabled.
Kids with long-haul COVID may now have certain new protections under the Americans with Disabilities Act. We'll explain. All of that and more, just ahead. After the day's news.
Live from NPR News in Washington, I'm Corva Coleman. Evacuation flights are still leaving the airport in Kabul, but many Afghans are still struggling to flee Afghanistan. Separately, the BBC's Sikander Kamani reports the Taliban seem to be planning their new government.
The Taliban is still in discussions with different political figures here, the former President Hamid Karzai, Dr. Abdullah, another senior political leader, as well as others. And so we'll get more details, I think, in the coming days of just exactly how the Taliban see the future of the country. One senior member of the group did give an interview to Reuters in which he talked about some kind of ruling council, shura, I imagine, being set up that would rule Afghanistan, not a democracy. So that would suggest some kind of perhaps theocratic state with the head of the Taliban as its leader.
The BBC's Sikander Kamani in Kabul. Aid is slowly arriving in Haiti to help people in the southern part of the country recover from a deadly earthquake. Thousands of people were killed and injured by last Saturday's tremor. NPR's Jason Beaubien is in southern Haiti. He says a couple of days after the quake, Haitians then got a tropical storm.
Even with Tropical Storm Grace having passed last night, we got slammed with another huge rainstorm. And this is falling on tens of thousands of people who are homeless. Many of them are sleeping in just flimsy shelters, sometimes not much more than a sheet of plastic. Cleanup has started, but it's been pretty much just to clear the roads. People are picking through some of the collapsed buildings, but really most of those buildings, those piles of rubble, they're just still there where they fell.
NPR's Jason Beaubien in southern Haiti. Meanwhile, Tropical Storm Grace made landfall on Mexico's southern Yucatan Peninsula today. Its top sustained winds are at 75 miles per hour, and it's moving inland. Separately, what was Tropical Storm Fred is streaming over the U.S. Northeast. Flash flood warnings are up for parts of New England. A member of the Sackler family, who led Purdue Pharma during years when the company aggressively marketed OxyContin and other opioid drugs, says he did nothing wrong. Richard Sackler testified Wednesday in a bankruptcy trial in New York. As NPR's Brian Mann reports, the trial continues today.
Purdue Pharma has admitted criminal wrongdoing for its false marketing of OxyContin, but the Sacklers, who own the company, have never been charged with any crime. During a rare court appearance Wednesday, former board member Richard Sackler was asked if he, his family, or his company bore any responsibility for an opioid crisis that's killed more than 500,000 people in the United States. Sackler answered no each time. Purdue Pharma filed for bankruptcy because of opioid lawsuits. The Sacklers aren't bankrupt, but as part of this process, they're demanding immunity from being sued in the future. In exchange, they've offered to pay roughly $4.3 billion to help fund addiction programs. Brian Mann, NPR News.
You're listening to NPR News.
And this is WJCT News 89.9 in Jacksonville. I'm Jamie Jackson. The time now is 9:04. The COVID-19 testing site that opened earlier this week at the St. Augustine Visitor Information Center will be free of charge starting this morning, thanks to state support. The site is being run by Flagler Health Plus in partnership with the City of St. Augustine and Ivy Medical. Anyone who's already been through the testing site will get a refund, and anyone who already has an appointment scheduled will not be charged. The testing site is at the bus loop on the north side of the big historic downtown building, or downtown parking facility rather, on Castillo Drive. And tests will be conducted from 8:30 to 1:30, Monday through Friday. Well, the Downtown Investment Authority tabled a vote yesterday on a development deal for the old Florida Times Union Building's property, so DIA staff can talk more with Fuqua Development about adding a riverfront restaurant that might require several $100,000 in taxpayer assistance. According to WJCT News partner, the Florida Times Union, the discussion on the old Times Union property located in the Brooklyn neighborhood just west of the Acosta Bridge had DIA board members considering paying half the cost for a new restaurant. Currently in Jacksonville, temperatures are in the high 70s. For your Thursday, expect a 40% chance of showers and thunderstorms mainly after 1. Partly sunny skies with a high near 94 and heat index values as high as 107. This is WJCT News 89.9 Jacksonville.
Your news.
Support for NPR comes from iDrive, providing cloud backup, full system backup, and on-site iDrive appliance to protect PCs, Macs, and servers from data loss due to crashes and ransomware at iDrive.com/NPR and Americans for the Arts.
Parents and teachers at the Duval County Public Schools call for contact tracing info to be made public. Good morning. We're live from Studio 5. I'm Melissa Ross, and this is First Coast Connect. Thanks for listening. Just ahead, a closer look at how contact tracing works, or maybe doesn't, here in Florida. Get on the line now with your questions, 549-2937. Then later, hospitals are in dire need of nurses. We'll tell you about a hiring fair this week at Baptist Health. But first this hour, contact tracing in schools. In Hillsborough County, which is the Tampa area, thousands of students are already in quarantine just a week after the start of school as COVID rips through the state, the Delta variant of the virus, that is. Meanwhile, the number of positive COVID cases affecting Duval County schools tripled between Friday and Monday, records show. As of Monday evening, Duval County Public Schools reported 222 COVID-19 cases. That's up 140 cases since Friday. This is all on the district's online COVID-19 dashboard. It shows positive cases affecting people on school campus. Now, the jump in cases represents a more than 170 percentage point increase from the first week of school up to now. Even with all that, medical professionals believe this could be an undercount. So it got us to wondering, how does contact tracing for the virus work in our area, both in schools and in the community at large? There have been concerns for some time that no effective contact tracing is being done in Florida by our public health department. Dr. Sunil Joshi is president of the Duval County Medical Society Foundation, and he's on the line. Doctor, always good to have you. Good morning.
Good morning, Melissa.
And as we talk about contact tracing, give us a call at 549-2937. Already getting your emails and tweets. We'll get to those in a moment. Okay. In a moment, Doctor, we'll talk about the Duval County Public Schools. But first, let's talk about Duval County at large. Why aren't we seeing more widespread contact tracing to try to grapple with this virus?
Yeah, I mean, it's a great question. Contact tracing would be huge in terms of our ability to mitigate the spread of this virus that's incredibly contagious. And a lot of this, we feel very strongly goes back to the fact that the Department of Health, who is responsible for contact tracing, doesn't have the staff and the ability to do it. I mean, when you're talking about a community of roughly 1 million people and having a 20 to 25% positivity rate, you're talking about large numbers of people who would then be involved in contact tracing. And I think it goes back to the lack of funding for public health in our state, but in particular in our community here in Duval County. And so it becomes a manpower issue as much as anything else.
And that's affecting the Duval County Public Schools. You and other infectious disease doctors believe the numbers coming out of the school system may actually be an undercount, right? Because there's a lag time between the first logging of the numbers and then the efforts of the school system to get that information out to families.
Right, and it absolutely has to be an undercount, when you think about it. And so because basically what happens is if a child has tested positive in one of our schools, the school contacts the Department of Health, or the district contacts the Department of Health, Duval County, who then is responsible for case investigation and looking at the seating chart in that classroom and seeing who may have been in direct contact within 6 feet of that child within the last 48 hours, and then they're to contact those family members, and that in itself takes a long process. I mean, there are stories from last school year where parents were receiving letters from the Department of Health saying that their child needed to isolate 13 days after the stores tested positive. At that point, the isolation period would have already ended, and so they are trying to do contact tracing. It seems to be delayed, and it's that delay that can ultimately lead to more spread. And that's why this has become so frustrating for all of us.
Right. Parents and teachers are so frustrated by this. They, not so much with the school system, but the Florida Health Department system, because the school system is dependent on that. Let me ask you, Dr. Joshi, we're hearing over in Tampa, the Hillsborough County schools have thousands of kids already in quarantine a week or so after the start of school. What are they doing differently in terms of contact tracing to quarantine that many kids?
Yeah, I think that they're very likely using common sense. If kids are testing positive, especially in the elementary school age group where they may not be wearing masks in particular, they're taking the students in that seating chart and asking them to isolate for the 10 days or to go get that test within 4 days to see if they're positive or not before returning back to school, which I think is the most common sense approach. If you know who the child is, go ahead and let the teacher, the school itself, handle that contact tracing because they know where the child has been. They know with the seating chart who's been around that child, what teacher was around that child, what resource class they may have gone to on that particular day, and you can identify the students at risk much faster that way. Relying on a third party to do that is, I think, what delays the process so significantly, and is probably leading to the fact that we are underrepresenting our number of positive cases here.
549-2937. Your questions answered about contact tracing in Florida, or really the lack of it. Give us a call. 549-2937. People tweeting the show right now. One listener says the DCPS dashboard now reports 423 cases, 357 students, 66 staff. St. Johns County has 175 positive kids and growing. And so parents are really frustrated by the way this is being handled. They want to know, should they contact the child's school or the Department of Health first? They're wondering why contact tracing has to go through the Department of Health, because that is causing a lag time, Dr. Joshi.
Yeah, and it absolutely is. And so in terms of, and one thing that's interesting, that the person who tweeted that, yeah, we have 423 cases now, and on Monday it was 200. We've doubled those cases in the last 48 hours. I think that's also important to keep in mind as the numbers are going up. And if you compare that to the first 10 days of school last year, you'll see that this is a significant increase. And there were definitely mitigation factors put in place last year that are not in place this year that may be contributing to that. But yeah, in terms of contacting the Department of Health, this is also very challenging. I would challenge some of the listeners to contact the Department of Health and see how long it takes for them to actually speak with someone. That's a challenge. And again, it goes back down to staffing and infrastructure associated with the Department of Health. I'm not, I totally respect everyone that's working at that office. It's very hard to get in contact with them at this point. And so, that is a good question. Why are we not allowing our schools to have a little bit more leeway in terms of contact tracing? Because I think if we did, we would be able to mitigate the spread much more efficiently.
549-2937. Mason in St. Augustine. Hi, Mason.
Hi, Melissa. How you doing today?
All right, thanks. Thanks for calling. Go ahead.
Yeah. I have a question. How come they're not doing any testing in schools? I got a letter from our school board kind of outlining the guidelines for testing and returning to class, and everything said should. So when I called the school nurse, she said you are not required to have a negative test, and technically you can send your kid to school with COVID, and there's nothing they can do about it.
It said that? Okay. Thanks, Mason. Doctor?
Yeah, I don't know. I'd be very interested in seeing that letter, but the Duval County Public Schools has a decision tree related to COVID-19. It is on their website. It's very similar to last year, but it does very clearly document when they feel like a child is more comfortable coming back to school. And so it does have a part of the protocol is to have a negative test, or for that child to be asymptomatic and have at least 7 days since they were exposed to the person who was positive before they would return to school. If someone was completely asymptomatic and exposed to somebody with COVID-19. So there is a decision tree there that does give good guidance in terms of when the child should come back to school. Now, in terms of testing at school, again, good question. Before you can perform a test on a child, you would, of course, need to get parental, consent to do that. So that's also part of the hesitation there. But we're having a hard enough time getting enough tests to test the general population, not to mention students at school. And so that's why this decision tree is so helpful, because even if you can't get a test, okay, follow the rest of the decision tree, which would involve isolating for a certain period of time, depending on whether or not you have symptoms or not.
Here's a tweet from a listener. When Duval County Public Schools has over 120 cases its first week, but quarantined slightly less than 50, are they doing contact tracing correctly? They seem to be saying kids who contracted COVID had very few close contacts, but we know that can't be true. So we see some districts doing this much more aggressively, Doctor, like Hillsborough County, which is the Tampa area. They've quarantined thousands of kids, and they had an emergency meeting last night on this. Mm-hmm. They and the Miami school district, along with a few other school districts, are defying the governor now and mandating masks for all students. And so what about this?
Yeah. And, and I give huge props to Miami-Dade County, Hillsborough County, and their school boards for understanding that they were losing the battle early in the game and to be aggressive at doing other things to protect not just the children, but the community at large, because these kids are also coming home, playing soccer, playing sports, and exposing themselves to other folks who may or may not be vaccinated. You know, just look at the numbers, Melissa, from last year in the first 10 days of school, even in Duval County, where we feel like we might be underrepresenting the number of positive cases, and compare it to this year. You know, that the 423 is significantly larger than what we had at the beginning of the school year last year. I believe in the first week of the school year last year, we only had like 20 cases. We're at 423 a week and a half into this school year. And what were we doing different last year? I mean, last year, we didn't even have vaccines. So, you know, our high school students weren't protected, but we were wearing masks. We were socially distancing. We were strongly encouraging hand washing. And our numbers were better in the school system last year than they are this year. And mitigation efforts do work. And I do think, and so that's why I'm proud of some of our counties in the southern part of the state that understand that. And I'm hoping that our school board will follow suit at some point.
You know, we received a call the other day from our youngest's high school, a robocall letting us know that there were 2 positive cases in her school and that they would let us know if our daughter needed to isolate if they determined that she had come in contact with these 2 positive kids. But of course, this is all dependent on self-reporting, Dr. Joshi. Parents have to figure out that their child has COVID, and they need to then self-report it, which, let's face it, not every parent's going to do that. So we're flying blind here, in other words.
And not only will they not report it, they may not even go and get tested. So you know, we you know, again, we are completely dependent on decision making at home as to whether or not a child is going to school symptomatic or not. And you know, like, as you know, I mean, the middle schools and high schools are no longer doing temperature checks. So this is something that's only happening at the elementary school level. And so, you know, I think that contributes to why we are having higher numbers this year than last year. I mean, these were low cost, minimally invasive interventions that were helpful at mitigating spread that we're not doing. And right now we're basically depending on people reporting their symptoms, people being honest with their classmates about whether or not they're positive or not and staying home or not. And not everybody's honest, unfortunately.
Chris is a teacher. She's on the line from Arlington. Hi, Chris. Good morning.
Hi.
It's a he. Hi, Chris. Go ahead.
It's perfectly fine. Hi, good morning. I'm a teacher of 8 years in DCPS, and we have a daughter who's recently gone into the school system. And everything's been going great thus far this year. We know how kind of the sausage is made, so we kind of know what to look for. And as soon as there was a case that popped up in the school, I kind of consider it a factor of 10. I think that there's probably about 10 cases in that school that have not been reported or underreported, like you're talking about. And so we kind of hold our student at home because we have that capability, but it's really hard for a lot of people to make that decision on a day-to-day basis. And I'm just kind of throwing out my rule of thumb because
yeah. So Chris, from your perspective as a teacher in the Duval County Public Schools, what more would you like to see the district do?
I would really like to see more reporting of quarantines. It feels like an underreporting on that number it's smoke in numbers, and that's not necessarily what you want to see in being transparent. So
do you feel that the district is not being transparent?
I don't necessarily want to make that statement. It appears that way. Okay.
Thank you, Chris. Dr. Joshi, we're not trying to impugn the school system because, of course, they are laboring under, as you said, a statewide public health system that is woefully inadequate to meet this crisis. That said, teachers have been expressing these concerns for a while.
And, you know, it's almost like when we talk about our issues in the hospital, you know, you really need to talk to the doctors that are working in the ER and that are on the hospital wards, and not just the doctors, the nurses, everybody in the hospital, to understand what's happening there. The same thing is true in schools. You know, it's easy for people who don't, number one, have children in school, or number two, are nowhere near a public school, to say it'll be fine. The teachers are the adults that are inside the schools that are seeing what's happening on a day-to-day basis. We need to take heed to what they are saying and follow recommendations of the people that are at the ground level, because ultimately the folks at the ground level are the ones that suffer the consequences the most. And it's like every part of this pandemic, it's the folks that are at the ground levels whose voices are not being heard. And it's frustrating from a medical perspective. It's frustrating from a public health perspective, and it's frustrating as a parent. And so I hear where the teacher is coming from, and I understand, and I'm hoping that our Duval County Public School Board is listening and is willing to adjust on the fly like they did last year.
Ann tweets the show, I was involved in PTA. We used to have room mothers. Why doesn't the district ask for volunteers to divide and conquer and call parents? Here's another tweet from Stephanie. I called St. Johns County Department of Health to self-report. I left a message with their call center. No callback. The St. Johns County Public Schools depends on Department of Health confirmation to allow kids back. My workaround was I spoke to a school nurse. And Dr. Joshi, here's another thought from a listener who expressed to us the other day. When a child in a school gets lice, that school moves mountains to let every parent know that there's a lice outbreak. And they go way above and beyond to stop that lice cold in its tracks.
Right.
So why can't we apply the same approach with this?
Well, that is an absolutely great analogy, because, all of those of us who've had kids in school have had that call multiple times through the years about a lice outbreak and how everybody panics about it. And the school takes care of that. That doesn't go through the Department of Health. And why can't we do the same thing here is a terrific question. Why are we depending on a state agency, as you said, that is woefully underfunded and understaffed, when our schools have the ability to make a few phone calls? And I love the idea from a caller about having the PTA have some volunteer parents that would be willing to make those calls. I mean, I guarantee you'd be finding enough parents to do that as they try to protect each other. And so, yes, I agree. That's a great analogy, and it does make you think, why are we doing that for kids with lice, and we're not doing that with kids with COVID, which puts other folks in the hospital?
Anna is calling from Palm Coast. Hello, Anna. How are you? Go ahead.
Hi. Good morning, Melissa.
Good morning.
The reason I'm calling, I was like, I have to call. I'm here in Palm Coast at my second home, but I do teach in a public school in Connecticut. And what you're discussing isn't just a Florida issue. That also happens in Connecticut. And I can speak from our experience at my school that at first contact tracing was being done quite well. And then as there was pressure on principals to, keep schools open, we were a mix of in class and virtual. So we teachers were teaching in class and also virtually at the same time. There was a lot more pressure. Things began to be a bit more secretive. The principal didn't really inform the staff. Some students would go out to be quarantined, one or two teachers, but it was all sort of very hush-hush. And again, it was the pressure to keep the schools open. And I've always felt, and I've discussed this with my colleagues, that if we were a profession primarily staffed by males, and this is just my feeling, we wouldn't be treated this way. And I also have major points of contention with our union leaders, both the National Education Association, American Federation of Teachers. They're really not out there, speaking about this. This goes to masks as well. Now, Governor Lamont in Connecticut just issued a state mask mandate for all schools, but there are a lot of parents in Connecticut who have signs on their lawns about the anti-mask as well. And again, I don't think that you would be getting this kind of reaction if we were coal miners, let's say.
Anna, I completely understand where you're coming from. And yes, we could go on all day about how female-dominated professions don't get the same level of respect, the same salaries, the same prestige. You couldn't be more right about that. And I also appreciate your call about pointing out that we are not alone in Florida with these issues by any means. So, Dr. Joshi, you have patients to see. What are your final thoughts?
Yeah, I mean, I think the contact tracing issue is an important one, and the only way that we may be able to get some move on that is if we keep talking about it and why it's important for us to contact trace appropriately and efficiently so that the folks that are at risk of spreading it to others are taken out of the system for that period of time. So contact tracing remains important. I am encouraging our patients and everyone that's listening to have their kids wear masks in school. It is so important. I know that Duval is requiring it with that opt-out option, and about 10% have opted out. But I also hear that there's really not a lot of enforcement. So please, please, please continue to encourage your kids to wear masks in school. It worked last year, and it will work this year too, in particular in those kids that cannot be vaccinated.
Dr. Sunil Joshi, he's president of the Duval County Medical Society Foundation. Thanks so much.
Thank you, Melissa.
Much more still ahead. Later, Women Writing for Change welcomes new writers to their circle here in Jacksonville. But up next.
All that the new regulations are doing is providing a common sense construct for us to understand that because of the unpredictability of long-term effects of COVID infection, it could very well leave an individual disabled.
There's a new classification for kids dealing with long-haul COVID. We'll explain next.
The Jacksonville area is home to 2 Navy bases, a Coast Guard headquarters, and a major National Guard base. It's an important city when it comes to national security. Join the American Security Project at 10 a.m. on Tuesday, August 24th, in partnership with ADAPT to learn about how our region's military installations are rising to meet the threat of climate change. Reserve your ticket now at wjct.org/events.
Hi, this is WJCT News Engagement Editor Sydney Bowles. This fall, we'll be launching a newsletter bringing the top stories from our region right to your inbox. And we want to make it something you're excited about. Share your thoughts now at wjct.org/survey. It's short, and it'll help us make sure we're serving you best. One more time, that's wjct.org/survey. Thanks.
Welcome back. Well, the Americans with Disabilities Act is now covering children with long-term COVID disabilities. For more about this, I spoke with federal civil rights and disability rights attorney Aaron Bates. A conversation on kids, long COVID, and schools. Take a listen. So, according to the ADA, kids with long-haul COVID are now classified as disabled. Tell us about this decision and what it means for children who've had struggles with long COVID.
Yeah, sure. And I don't know so much that the amendments to the regulations of the Americans with Disabilities Act specifically lay out that long-haul COVID is a disabling condition. I think all that the new regulations are actually doing is providing a common sense construct for us to understand that because of the unpredictability of long-term effects of COVID infection, it could very well leave an individual disabled. And the ADA just defines disability. It doesn't define it based on, well, you have cancer, or you have muscular dystrophy, or you have autism. What it looks like is it looks at your impairments of your daily activities of daily living, and if you are limited in those activities to the extent required by law, then you are considered disabled for purposes of whether it be federal benefits or civil rights laws, which is what we do at our firm, part of what we do at our firm. So with this, the COVID pandemic, now we've got all of these different disabling conditions that have arisen from long-term COVID exposure, and we're seeing it in children now. So from a standpoint of a parent, they've gone from having a child that would not be disabled to, for all intents and purposes, is protected under all laws protecting someone, say, with autism or Down syndrome. So that's what the change in the regulations essentially means.
How does that enable parents to make sure their children's rights are protected, particularly in schools, if their child has a 504 plan or an IEP, individual education plan? How does this help parents and kids in schools?
Well, unfortunately, most parents that are dealing with 504 plans and the IDEA and IEPs and things of that nature, they've been doing that their entire lives. Their child was most likely born disabled, and they've been dealing with the results of that, for the entire life of the child. So, most parents are accustomed to the IEP process and things of that nature. If it's a disability that just happened as a result of COVID or a car accident or whatever that may be, it's a new experience for the person or the family dealing with the disability. And my best advice is probably, multi-tiered. One is, obviously, you want to find others in the community that are experiencing conditions similar to you, because most likely someone's already paved the path that you're going to end up walking down. And then second, unfortunately, school systems, especially in Duval County, where I was born and raised, are still severely behind the times when we look nationally at the education provided to students with disabilities. So as a parent with a disabled student, especially in somewhere like Duval County, you have to be very vigilant that your child is receiving what they are entitled to as a result of their protected status. And often that requires the input of education professionals, lawyers like myself, and others. The good thing is there's a very good core group in Jacksonville of outside education and legal professionals that know what is required and what's not required, and they do great work for families in Duval County. So, if we can't help you, we do know individuals in the area that can.
This does put more burden on schools in Northeast Florida, doesn't it, to treat these children as part of a protected class? We have heard about parents who have had problems with their kids, who have been out sick for months with long COVID, and have had trouble getting the school district to acknowledge how that has affected their child's academic and social growth.
Right. Unfortunately, what you just recounted is not new. I've seen this in the legal profession for over 15 years, and I've seen it individually as an individual living with a severe disability for over 40 years now. And the problem is that unfortunately, again, I hate to talk down on the county I was born and raised, but the Duval County school system just absolutely has no capability of effective long-term management and education of students with disabilities. They treat disabilities as the same. They don't differentiate, and often they fight the fact that someone is, claiming disability when it's very clear that there's a disabling condition. So what that means for parents is, again, what I said before, you've got to be vigilant, and it may take help from, an attorney or an outside educational professional. I've sat in, often I've had to go sit in IEP meetings just to be present so the school knew the parent was serious. They brought their attorney to their IEP meeting, and they want to make sure their kid is entitled and receives everything they're entitled to under the Protections of the Rehabilitation Act and the Americans with Disabilities Act. What people need to be mindful of is the Duval County and the state of Florida receives millions of dollars for education of individuals with disabilities. So it's not like it's a shortage of resource issue. It's a matter of they don't want to allocate the resources, and so they fight on issues that might be debatable when it comes to disability. I can't tell you how many times I've sat in a meeting with a school professional about something that was so absurd considering the disability of the student we were talking about. So honestly, you just have to be vigilant as a parent and understand that ultimately you know what's best for your child.
Thank you, Aaron. He's Aaron Bates, a federal civil rights attorney here in Florida. and certainly more and more parents are needing this information. Thanks so much for joining us.
No problem.
It's the biggest stories affecting the Sunshine State. Hi, I'm Melissa Ross.
And I'm Tom Hudson. Join us Friday for the Florida Roundup.
Each week at noon, we interview newsmakers and people from across the state discussing the stories and issues that affect your life. What's driving the conversation in Florida?
Join the conversation on the Florida Roundup.
Every Friday at noon on WJCT News 89.9.
The Jacksonville Music Experience from WJCT Public Media is your ticket to the local scene. Music reviews, curated playlists, music history, concert recommendations, profiles of local artists, and more. Turn your ear on the beautiful noise emerging from Northeast Florida and learn more about the local artist whose music is reverberating across the country. Visit jaxmusic.org to play it local and play it loud.
Well, Baptist Health is hosting a career fair today, and they need nurses. Tammy Daniel is Senior Vice President and Chief Nursing Officer at Baptist Health. She's on the line. Hi, Tammy.
Good morning.
And so
Thanks
good to
for
have you on
having
the
me.
show. We must disclose Baptist Health is a sponsor of this program. Let me ask you about the nursing shortage, because we're hearing it's a big issue in hospitals across the country, including right here in town. Tell us what's going on.
Well, the nursing shortage really started even before this pandemic. We've had so many needs for nurses. The Bureau of Healthcare Statistics even projects that by the year 2029, we're going to need 3.3 million nurses in the United States. And right now we're at 3 million. So that is a significant increase in the number of RNs needed. At the same time, we have our baby boomers and other people exiting the nursing field. So the shortage is really impacting not only the Jacksonville market, but the whole United States. And unfortunately, when you look at the data, including the American Association of Colleges, they say that the projected shortage is going to be the most intense in the South and in the western parts of the United States. So we're all headed into a big issue if we don't start filling these positions quickly.
Absolutely. And I would think right now it's more critical than ever, because nurses on the front lines of this pandemic are doing incredible work, and they're getting burned out and they're getting discouraged. It's got to be so tough.
It is tough. And, I'm so proud of our nursing team because it's, they're on the front line. They step right up and they take care of whatever the situation is. And, we've had these rebounding surges where just when you think that, the COVID numbers are going down, we've had this big increase where the hospitals in the Jacksonville area, are completely full. And we're, adding beds across the system to make additional space for not only COVID patients, but other patients, because we need to take care of them. And, I would say it's emotional. It's also kind of sad. Many of them are sad because they look at the situation and think, well, if we would get more people vaccinated, we might not be in this situation. So there's a lot of emotion along with, just that fear and, like you said, exhaustion. But they're doing an amazing job. I'm so proud of them.
I can guess that for sure. And you are the Chief Nursing Officer at Baptist Health, so kudos to you for helping so many people out there. Okay, so tell us what the need is at Baptist Health. In a moment, we'll give details about the career fair. How many positions are you looking to fill? What are the details?
So we have several new areas that we're opening in Baptist Health. We're opening up a new hospital in Clay, and we're continuing to grow. We have a new entry building for our children's hospital. So in addition to the openings that we already had, over 100 RN openings, we are projecting growth. And so we know that we're going to need to fill over 200 nursing positions to accommodate all of these new spaces and to deliver the care that we need to for our patients. So even though we have 300 new nurses join in our residency program every year, just because nursing is such a mobile field and people can, go to travel assignments and step out of the profession, our vacancy rate is up over 20% and hitting up into 30%. So we need over 200 nurses just to fill, what we know we're going to need in 2022.
Mm-hmm.
So that's why we're exploring the opportunity to add additional, nursing staff with the LPNs into our workforce.
And these are permanent positions?
Absolutely. Yes, this isn't related to COVID. We really had this plan in place before the COVID surge, this last surge hit, because we knew, like I said earlier, when you highlighted, the projections say that this is coming. And so we've been planning this for quite a while. And to your point, the COVID, situation where some nurses have taken travel assignments and left, and some have decided that this may not be the profession for me, has, made the need even greater.
Right. And aren't nurses' salaries going through the roof right now because the demand is so great?
Yeah, you hit on something that's really important. Yes, and we've done some market adjustments, and you probably see if you look on any of the journals or anything that bonuses are just going through the roof because it is such a competitive market, which I've always felt like nurses should be paid more. I'm happy to see that part of it, but it's not sustainable to be, to do this, what we're going through right now.
Well, what if you could give me a ballpark? What are nurses making right now? What's the basic salary range?
Well, what's happening is, you have our basic salary range where that stayed the same. So you were saying like entry level positions in the $30 an hour area and then up quite a bit based on your experience. But what we're seeing, Melissa, is these additional bonuses that we're having to put on top of it. And then we have, to bring travelers into the area because we've had 200 beds added into our system in less than a month's time. So we needed to bring extra resources in. And so they make a significant salary too. So a good example is over the weekend when we need to, get more staff in, they're not only making their salary and overtime, but we're paying $1,000 bonus for a 12-hour shift just to make sure that we can fill all
shift.
Yeah.
So a nurse could make a 6-figure salary easily in this time.
In this time, that's what I'm saying. I'm happy that nurses are making more money, but that's just when you look at the number of nurses. We have almost 4,000 nurses in just the Baptist Health System. Financially, it's just not sustainable.
What's the biggest challenge for you as the chief nursing officer at Baptist Health to keep the morale up among your nursing staff, keep them on the job?
Yeah, just to recognize that, we're all in this together and it's a team effort, and to let them know, communicate. Let them know in advance as much as we can of what we're doing, because silence gets filled in with all kinds of, misinformation and rumors. And so just be out in front of them and letting them know that, yes, I know you're working extremely hard and we need more nurses, but this is our plan. This is our plan to bring in more travelers. This is our plan to use international recruited nurses. This is our plan to bring in LPNs so that they just keep their hope up. That's what we're trying to do, keep people hopeful.
I'm sure that's got to be tough because as we've been following along with this, doctors and nurses are seeing so much death and heartbreak, seeing whole families die of COVID-19, Tammy.
That's really hard.
It's just unbelievable. And knowing that if they had gotten vaccinated, they'd likely still be alive. I can't imagine how hard it is to care for someone and doing everything you can to save them when it could have been avoided.
Yeah, that's what I was saying. Our nursing staff is sad. I would say that that's one of the hardest things because think about, we can't have visitors in the hospital right now. It just is too high a risk, right, for continuing the spread. And so these patients that are at the end of life are, by themselves with our nursing staff holding their hands. And so that makes it really, really difficult when you come in one day and you think somebody's getting better. They might get, weaned from the ventilator, and then the next day you come in and they've passed away. And so that's how quickly this progresses. respiratory illness is intense. And we're trying to keep people off the respirators because they often don't come off if they get on. So it's emotional. We have had whole families. We've had unfortunately.
Yeah.
And
so with all of that said, let's talk about the career fair. This is the Baptist Health LPN Career Fair. 2 sessions this afternoon and this evening. Can you talk about that?
We're having a session at 4:30 to 6 for 150 LPNs to come in. We've sent Eventbrite invitations out. They can go in and register there. And then to follow that, there's a session from 6 to 7:30 at WJCT. Thank you so much for offering your space and helping this. This is an open house for LPNs. We know there's about 3,200 LPNs living in the Jacksonville area, and we're trying to invite them in to learn more about what it would look like to work in acute care, because currently most LPNs work outside of the hospitals. They work in skilled facilities or in other ambulatory areas. And so we want to invite them to say, we have opportunities in Baptist Health, and you look really good in blue scrubs. So come and learn more about what we have to offer.
Check it out. 2 sessions here at WJCT Public Media this afternoon and this evening. It's the Baptist Health LPN Career Fair. RSVP required on Eventbrite, but it's free. Masks required. And
free and a lot of door prizes.
Yeah, and prizes and heavy hors d'oeuvres. So check it out, folks. And thank you, Tammy Daniels, Senior VP and Chief Nursing Officer at Baptist Health. Thanks so much.
Thank you. Have a great day.
A quick break, and in a moment, changing Jacksonville through words on a page. That's next.
Community First Mortgage Champions are committed to offering a great rate, a quick close, and fewer costs at closing. Accepting applications at communityfirstfl.org. Community First Credit Union, federally insured by NCUA, Equal Housing Lender.
WinGuard, a Jacksonville-based marketing and communications agency, provides Northeast Florida businesses with services to help with their reopening, such as digital and social media marketing, local advertising, and public relations. More information at wearewinguard.com.
The Jacksonville area is home to 2 Navy bases, a Coast Guard headquarters, and a major National Guard base. It's an important city when it comes to national security. Join the American Security Project at 10 a.m. on Tuesday, August 24th, in partnership with ADAPT, to learn about how our region's military installations are rising to meet the threat of climate change. Reserve your ticket now at wjct.org/events.
I'm Marco Werman. We're living through history, and the world's newsroom has the first draft.
The president, sadly, has recreated the same environment we had just before 9/11.
As we always say, if you protect one region of the world, you are just shooting yourself in the foot, because those gains will be very short-lived.
Looking for answers and making sense of global events as they happen. Join us on The World.
This afternoon at 3, here on WJCT News 89.9.
20 years ago, Michael was part of the 82nd Airborne Division in Afghanistan fighting the Taliban.
The same group we tried to get rid of is now sitting in the palace in Kabul, and this needs to be fixed ASAP.
What was it all for? And can the president deliver on his promise to help those who helped us? We'll have the latest next time on 1A.
Today, starting at 10 on WJCT News 89.9.
Welcome back. Well, there is a community of women writers organizing in North Florida for a better community. Jen Wolf leads the local chapter of Women Writing for Change. She's hosting a Zoom reception tomorrow and welcoming new writers to her circle. Hey, Jennifer, good to be with you. Thanks for joining us.
Well, thank you, Melissa. Always a pleasure.
So you're busy and you've got a lot going on with Women Writing for a Change Jacksonville. What's on the agenda?
Well, we're starting out the semester centering our writers with a writer's reception. And that will happen at on August 20th. And then we're kicking off the semester with our writing classes at the end of August and beginning in September. And we're following the theme of the river. After all, we are in the River City, right?
Mm-hmm.
So rivers is our theme this fall for some of our writing classes, and it's also the theme of our art exhibition. Our art exhibition will open at the end of September 25th, and it's curated by Mallory O'Connor, who has been a professor at UF and also at Santa Fe, and she's an author who's written on the topic of rivers, including the St. John's. And so we'll have regional artists as well as our Jacksonville artists featured in this particular show. And we're hoping that that event will be able to be mostly outdoors and able to happen in person, but we're watching the situation, of course, with COVID in Jacksonville very closely.
Right. Now, you chose the theme of the river because, of course, the St. John's River is so important to this community, but you also chose it because its water symbolizes other things. Can you explain?
Absolutely. Well, water is symbolically important to represent the feminine. And I believe that one of the most undervalued assets of Jacksonville is not only the river, but also the women of this community and the force of the feminine. So we're lifting that up. The river also represents change and the importance of being able to flow with the river, flow with the currents, and to understand the power of it. And of course, the other thing about Jacksonville that many people don't know is we actually have 9 different rivers. And rivers are the heart of any community. I mean, as we know, cities and towns grow up around rivers. And that is a very important and undervalued and usually often wasted resource. And I don't even like to call it a resource. I like to call it an important asset of any community. So we're all about symbolism, and if we can lift the rivers and the feminine and the need to care for our environment as we evolve as a community and as a country, then I think we're on the right topic.
Yeah. And that's what your organization's all about. It's a local affiliate of a national organization centering the voices of women in writing, art, community building. And you've grown this significantly since you founded it in Jacksonville a few years ago.
Yes, well, taking it to a nonprofit was very helpful and very important because one thing we wanted to make sure of was that our programs would be accessible to anyone and everyone, but centering the women. So we're not, we include men and other genders in our program, but we do center women. So it's the difference between centering and being exclusive. So we want to be a radically inclusive organization, and we're very intentional about it. So we want people that are from all walks of life, and we're very intentionally setting up our leadership group to be a diverse group of women representing different walks of life. We made our classes, of course, we had to pivot last year and do all of our programs on Zoom. And then we found the great benefit is that it means they're accessible to anyone. So we've maintained that, and now we always will have that ability, the hybrid option, some things in person and some things virtually. And that's been terrific for many folks, including some folks who are disabled and are not able to come to a circle. So we're trying to be radically inclusive, and we're trying to reach people who need us and need to have their stories told and need to tell their stories and be heard and listened.
Yeah.
And it's fun work. It's good work.
Sure. And I encourage everyone to check it out at womenwritingjacksonville.org. Jennifer Wolf, founder, executive director of Women Writing for a Change Jacksonville. Thanks so much.
Thank you, Melissa.
And thanks for listening. Thanks also to producer Heather Schatz, director Josh Torres, associate producer Catherine Hobbs, and editorial director Jessica Palumbo, plus digital editor Bill Bortsfield. I'm Melissa Ross. We love your feedback. Drop us a line at firstcoastconnect@wjct.org. And make sure to join us tomorrow for our Friday Media Roundtable. We'll be back then at 9 a.m. Have a great day. Be safe, mask up, get vaccinated.
Support for First Coast Connect is provided by Baptist Health and the North Florida